Hi, everyone, and I'm excited to have you joining me for episode 761 of People Behind the Science. I'm your host, Dr. Marie McNeely, and today I'll be joined by our guest, Dr. Kim Waddell, to talk about life and science. I hope you enjoy getting a behind-the-scenes look into the life and experiences of another researcher in today's episode. And if you want to get to meet even more of today's scientists, you can check out our website at peoplebehindthescience.com or subscribe to our show on your favorite podcast platform. And today, Kim is going to share some of her own insights and stories. So get ready to meet another one of our brilliant people behind the science.
Every day, discoveries are made that will change our understanding of the world around us. Dr. Marie McNeely is here to bring you the brilliant minds who are making these discoveries so they can share their incredible stories and take you on an amazing journey. Welcome to People Behind the Science.
Hello, everyone, and welcome to People Behind the Science. Today, I am excited to be speaking with our guest scientist, Dr. Kim Waddell. So, Kim, welcome to the show today. How are you?
Hi, Marie. I'm good. Thank you for having me.
Well, Kim, thank you so much for joining us. And I'm looking forward to talking more about you and the wonderful work you do with our listeners. But first, let me tell them a little bit more about you and how you got to where you are today. So listeners, Kim is an assistant professor in physical medicine and rehabilitation at the University of Pennsylvania's Perelman School of Medicine, as well as a faculty member in the Center for Health Incentives and Behavioral Economics, a senior fellow in the Leonard Davis Institute of Health Economics, and research and innovation manager in the Penn Medicine Nudge Unit at the University of Pennsylvania. In addition, Kim is a research health scientist at the VA Center for Health Equity Research and Promotion. She received her bachelor's degree in health science from Truman State University and her master's degree in occupational therapy from the University of North Carolina at Chapel Hill. Kim then attended Washington University in St. Louis, where she earned her PhD in movement science and her master's degree in clinical investigation. Kim conducted postdoctoral research at the VA and Penn before joining the faculty there. And recently, Kim was awarded the 2024 Academy of Behavioral Medicine Research's Early Stage Investigator Award. And in our conversation today, she is going to share more about her life and her research. So Kim, we're excited to get to know you as a scientist, of course, but also more generally as a person. So can you tell us, what do you like to do when you're not doing science?
I really enjoy running. That's something that I try and do as often as possible to just sort of clear my head, disconnect from technology, sometimes think about science and sometimes not. I also really enjoy cooking, trying new recipes. I'm not a very good baker, but I'm pretty good at cooking. That's something that brings me a lot of joy. And then, of course, we enjoy traveling, and we live in Philadelphia. And for anyone who knows anything about sports, it's a very big sports city. So we also like to go to 76ers games, or we went to an Eagles game this past year. So going to sporting events has been really fun.
It's amazing. It sounds like you've got a lot of fun hobbies and activities outside of science, but I know the science keeps you quite busy as well. So I'd love to chat about that next. So Kim, how do you describe your work to someone who is outside of your field completely, or maybe not in science at all?
I would start by saying that I study behavior change, specifically how to help motivate people to make decisions that are more aligned with their longer term goals. I tend to focus on physical activity and trying to help motivate adults who have had a stroke or who have Parkinson's disease to increase their daily steps using insights from behavioral science. Behavioral science is a really cool field that helps us understand how and why people make decisions and how we can in turn help motivate them to make choices that are better aligned with their health goals or what they're hoping to accomplish. I will say in addition to that, I also use electronic health record data and administrative data to try and understand care processes related to stroke and stroke-related care. Specifically, I'm really interested into questions like who has access to rehabilitation care after a stroke, how much rehab services do people get, and how there may be disparities in that care, with the goal of, if we can understand these care processes, we could design clinical decision supports or ways to help improve our decision making to make sure that the right people are getting the right amount of rehab.
I think that's wonderful. I think in particular, this behavioral change field is a fascinating area of research, and I think relevant to a lot of us who are maybe guilty of not aligning our short-term decisions with those long-term goals. So I look forward to digging into some of the details of your research as we go through our conversation. But I think maybe doing research on how to help motivate people, you have some particular tips, tricks, things that help keep you motivated. So Kim, do you have quotes or sayings or things that really keep you motivated and inspired in life or in science?
I found a lot of really good quotes along the way, but I think the one that I probably resonates the most with me, or I think about the most, is actually a Maya Angelou quote that people will forget what you said and that they'll forget what you did, but they'll never forget how you made them feel. And I think about that quote a lot in life and how my actions and words are making people feel valued and heard, but then also in science as well, making sure that it can be a competitive field. And we've all probably encountered people who can be a little competitive or a little bit sharp who made you feel not great. So I think about this a lot and just making sure that I'm mindful in my interactions with others, that the people don't forget how you made them feel. So you want to be kind and gracious towards others.
Absolutely. And I think as a mentorship trait, this ability to make people feel valued, this ability to make people inspired and motivated to go in and do work for you every day can also be quite valuable in science. So when you think about your own mentors, role models, people who helped you become the person you are today, who are some of the people who rise to the top of your mind?
I feel like I am a product of great mentoring and a product of just a lot of really incredible scientists who have invested in me. But probably on the long list of names, by far, the person at the top is Catherine Lang, who is a professor at Washington University and my PhD mentor. Catherine's really been a role model to me, both in terms of science, but then also in life as well. She's a brilliant scientist. She studies very real issues in the field of rehabilitation. And I gave a talk last week and I was talking with someone who knows Catherine and was just talking about how she has this incredible way of quantifying these really real issues in rehabilitation that have set research agendas after the fact. And she does it in such a rigorous way. And so I think in terms of science and how to conduct rigorous science that's meaningful and applicable to real world clinical practice, she's been a role model. But then also in life, as a mom and as an academic, I've watched Catherine for years balance the two. At the time when I was training in her lab, I didn't have children, but she put her daughter and her family, made them a top priority. You know, she might leave early on an afternoon because her daughter had a track meet, or she would only travel 1 or 2 nights for something because she wanted to get home to her family. And I remember at the time thinking like, oh, we're in San Diego. Don't you want to stay for a few more nights? And then now that I have children, I'm like, oh no, I don't want to stay more than 2 nights. I want to get home. And so she seemed to just balance being an academic and being a mom so well. And she was never really loud about it. She just did it. Like she didn't draw attention to it. If you weren't paying attention, you almost didn't even notice how good she was at balancing those two things. And so I think now, especially as I have children, I think back a lot to things that Catherine did or said that really have served as kind of a role model for me in being both an academic and a mom.
Definitely. And I think that ability to set priorities and boundaries can be really difficult. So wonderful to actually see that in action in a mentor that you had. And you mentioned that you've had a lot of great mentors along the way. I'd love to hear more about your story, Kim. So can you walk us all the way back to the beginning to young Kim and tell us what first got you interested in science or rehabilitation?
This is quite a story. I enjoy sharing it to anyone who will listen because I don't want to say it's non-traditional, but I certainly was never the person who is just like obsessed with science or in my room running scientific experiments. When I was a kid, I was usually the kid outside kicking a ball against the garage door or playing outside. But when I finished OT school, I didn't really have any interest in research. I wanted to be a clinician. So my first job was actually at the Rehab Institute of Chicago, or now the Shirley Ryan Ability Lab. And I worked as a full-time therapist for 4.5 years or so in patient rehab and absolutely loved being a clinician and really didn't want anything to do with research. But I kind of had a question about upper limb therapy post-stroke, and RIC offered 1-year research grants to clinicians who were interested in research but didn't want to leave full-time practice. And so I actually got this grant. Catherine agreed to mentor me remotely. That's how we met. And it was through this 1-year fellowship that I started to realize that I actually found research to be pretty exciting and that I wanted to know a little bit more about it. And at that time, Catherine had planted a seed about me doing a PhD, to which I said no. I do not want to do that. But over a year or two of dragging my feet, I ultimately took a research therapist position in Catherine's lab. So I moved from Chicago to St. Louis. And I worked on a clinical trial that she was running at the time as a therapist and continued to just sort of feel that like interest in research and that research desire grow and grow. And so finally, after probably 4 years of dragging my feet, went back to do a PhD. But even in then, I said, I'm only doing a PhD because I want to teach in an OT program. So yeah, I started the PhD thinking that I would just teach and that would be primarily what I do. But now I do mostly research. And so I think kind of the thread that laces that together is just that I was just kind of honest about my interests at the time and have come to realize that the pursuit of new knowledge and studying questions that are exciting are just really fun. And I've really enjoyed that. But I certainly took time to get to this point. And now I certainly love the research that I do and being involved in it. But that's kind of my journey of twists and turns, if you will.
Absolutely. And I'm curious to hear where this interest in occupational therapy started. We sort of started at this point where, well, yeah, I went to OT school. What brought you to OT school?
I always had an interest in therapy. I played sports as a kid and had my fair share of physical therapy encounters and really liked the focus on healing and the relationships that you get to build with patients. In my freshman year of college, there was an upperclassman who was kind of a mentor to me. She was going to OT school. So I was like, I haven't really heard of that before. And so I looked it up and thought, wow, this is really cool. I like how it focuses on function and focuses on activities that are meaningful to people and how that really varies from person to person. And so that was my freshman year in college where I was like, I think I want to be an OT and really haven't looked back since.
Very cool. And I know the work that you're doing today combines your expertise in occupational therapy with this rehabilitation research, with this behavioral economics, which I think is a cool angle. So can you tell us a little bit more about the research you're doing today, Kim? And is there a project in particular that you are working on at the moment that you are the most excited about?
I have a lot of projects that are ongoing and ones that are just starting, but I think one that I've been most excited about recently is actually a pilot grant that I just found out that I received that's looking at cognitive bias in the decision for where someone goes for rehabilitation post-stroke. I'm really interested in how therapists come to make their recommendation for what type of therapy someone should get when they leave the hospital. And the reason for this is that two things. One is that it's a highly subjective decision. There are no algorithms. There are no set criteria that's like, if this, then inpatient rehab. If this, then you go home. It's sort of a cocktail of information sources that are poorly described, and probably different therapists assign different weight or value to these information sources. And we haven't really ever looked into what are the information sources that we anchor this recommendation to. Or there's been work done in behavioral economics and decision-making with physicians that even just the time of day that you make a decision can impact your recommendation. Like you're less likely to prescribe a statin to someone if you're seen in the afternoon than in the morning. And there's these sort of cognitive biases that exist that we haven't really put to test in a really important decision like recommending where someone goes for rehab. And another reason that I'm particularly excited about this is that there's quite a lot of literature out there that's looked at factors that are associated with where someone goes for rehab. Like if you're an older age or a more severe stroke, or you stay in the hospital longer, you're more likely to maybe go to a skilled nursing facility. But we haven't ever really looked at the upstream factors that sets the whole process in motion, which is the acute therapist making their initial recommendation for where someone should go. And so I just got a pilot grant to look into this a little bit and see, is there bias in this decision, or what information sources are we anchoring these recommendations to? And I think it's just going to be really interesting to dig into this a little bit more.
Absolutely. And do you have thoughts on maybe to what extent patient factors or preferences are worked into this equation versus the therapist recommendations themselves?
Yeah, that's something, again, that I don't think we factored very well. Insurance is a huge driver of this. So insurance, prior authorization, things like that, that can really tip where someone goes, especially for post-acute rehabilitation. Patients certainly get to chime in on their preferences, but at the end of the day, if you are going to go to inpatient rehab, there are certain criteria that have to be fulfilled from a payer perspective. Like you have to be anticipated to return home. We have to be able to tolerate 3 hours of therapy a day. So you certainly can advocate and chime in as to where you would like to go, but there are other kind of external factors that are at play as well, which is why it just is such a messy decision in a complicated one. And I don't know what it is, but I tend to be drawn to like really messy, complicated questions or behaviors and try to kind of tease out different pieces of those.
I think that's remarkable. And I think you sort of hinted at it, but the trajectory of your rehabilitation can change dramatically based on that acute phase after stroke and what the rehab process looks like. So can you comment on the potential impacts of this kind of work?
Well, the stakes are high with this type of decision. And I could see that depending on what we find, this could lend itself to developing sort of a clinical decision support where we try and remove some of the subjectivity and some of the noise in this decision and try and make it a little bit more quantitative or objective to try and help make sure that people are going where they really should go and would benefit from the most. I think this would also lend itself to just potentially even nudge interventions, which is an arm of my research where we use the electronic health record to sort of help make the right choice, the easiest choice or default. And so thinking about how we could build in a nudge to clinicians that would help them with the decision making, that would help them integrate the necessary pieces of information and make their recommendation, but do it in a way that wouldn't add burden or effort to their day and sort of align with their workflow. So I think those are probably the two most immediate examples. But I also think this type of work too lends itself to sort of quasi-experimental studies where you could, in theory, you're randomly assigned your therapist at acute care. So you could kind of look to see like, well, do outcomes vary based off of certain randomization schema in this sort of quasi-experimental way. So we'll see. I think it really depends on what we find. But I think the lowest hanging fruit is probably the clinical decision support tool.
Definitely. Well, Kim, this is really interesting research. And you mentioned, of course, that you like complex or difficult problems. And I think science is full of difficult problems and full of failures. And I think that's something that not a lot of people realize when they're getting into science is that failure is tremendously common. So can you tell us maybe a little bit more about a time where you failed, or maybe you had a major problem that you had to struggle through, and walk us through the process of how you got through that difficult time?
Well, as an assistant professor, I feel like every day at some point it's like an exhale or feeling a little bit deflated or something. But probably what comes to mind is that I had a grant recently, my very first NIH grant submission, an early career award, that I just poured my heart and soul into preparing this grant. I worked really hard for months on it. I loved the idea. I was very passionate about it, and it wasn't discussed.
Oh, no.
And you open up ERA Commons and you see that not discussed, and it's just like someone has kicked you in the stomach. That was a bad day. That was really tough. And I did feel a lot like a failure. Like I thought that I had it right. I thought that I really pitched the idea in a compelling way, but the reviewers didn't see it that way. And so I had to let it sit actually for a few weeks. Especially after I got the summary statement where it was just totally shredded, and had to sort of lick my wounds for a couple of weeks and know that it was okay to step away from the project and to step away from the feedback and simmer in it when I needed to, but then go for a run or try to just think about something else. And then another thing I found particularly helpful to me was leaning into my mentors. And I think as early career researchers and assistant professors, the mentors that you have, we talk a lot about that in your PhD, and we talk a lot about your postdoc mentor, but we don't talk enough about your mentor as an assistant professor. And I was able to turn to a few mentors and send them the summary statement. And just, when I was ready to bounce around ideas or an action plan of, can this be salvaged? Should I resubmit? And just hearing their stories of failure and times when their grants weren't discussed and how they addressed it was super helpful too. So that's probably some of the things that I found to be most helpful in working through that failure.
Well, definitely. I think you hit the point there, Kim, that sharing these stories is critical, because I think when we see these successful scientists, we assume that like everything went well at every step of the way. And I think that's not the case for so many scientists. So just knowing that you can get past this sort of tragic first grant submission, I think is a huge way to bolster your confidence and motivate you to try again.
Marie, that's actually really funny that you say that, because I talked about how Catherine is a role model. And one thing that I've never seen Catherine go through is not getting a grant. What a great problem to have. And I'm sure early in her career, she didn't get grants. But when I came into her lab, she seemed to have a pretty good success rate. And so when my grant was triaged, I just had this moment where I was like, oh man, I don't know what to do, because I've never really seen mentors fail in that way. But as it turns out, senior scientists don't get grants. And I was able to lean into some other mentors, but I joke that that's one thing I've never seen Catherine go through, and that's not getting a grant that she applies for. So goals, I guess, squad goals.
That's right. And I think, like we said, important to learn these lessons along the way. And we know that you've had successes to celebrate as well. And I think these are really important to take the time to celebrate, because so much of science is hard work and struggles and kind of picking yourself back up after failures. So we love to celebrate the big wins as well as the small victories. So Kim, do you have a favorite success story, whether it was one of these big wins or just a small but particularly meaningful win for you?
Yeah. So swinging the pendulum from a grant not getting funded to just earlier this week, I found out that my career development award should be funded. That's a 5-year kind of the first big grant that a lot of assistant professors get. And so that is a big win, and I'm really excited for that. And then at the same time this is happening, I found out that I also got another pilot grant. I spend a lot of time in the fall submitting grants, and it's been really exciting that actually a couple are getting funded. So I'm currently and actively celebrating those wins right now.
I think that's amazing. So how did you react when you first saw on the computer screen that Success Career Development Award likely to be funded?
Burst into tears. I just burst into tears because I was so happy, and I threw my chair back in my office and just sort of sat there like, I can't believe it kind of thing. And then, of course, texted my mentor to tell him my score and went for a walk and got some ice cream after that. But my first very immediate reaction was just bursting into tears, and it was a combo of excitement and relief.
Well, I think that is amazing. And like we said, so important to sort of cherish those moments of success, because I think science can be a little bit all consuming. We encourage people to expand their minds, have hobbies outside of science, and read broadly as well. So do you have a book recommendation that you can share with me and our listeners that we can add to our reading list?
Yes, I love to read. So we could spend the rest of this time on book recommendations. If I'm allowed to, I'll share two. I think the one that comes to mind in terms of science, or for anyone who might be interested in behavioral economics or behavior change, The Voltage Effect by John List was a really incredible book that really had me thinking a lot about designing interventions, thinking about what he calls voltage drops, or places where your intervention might grow weaker environments. And I thought that was just a really great book. And then on the personal side, I actually just finished a book by Kristen Hanna, who's one of my favorite authors, called The Women. This is one of her newer books. It was actually about a woman and then her two friends who were combat nurses in Vietnam. And the first half of the book is just about the experience serving in Vietnam during the war. And then the second half is about returning home and the challenges and the difficulties that our Vietnam veterans face. And of course, this was historical fiction, but Kristen Hanna almost always has a pretty honest or truthful slant to things. And it really made me think a lot about our veterans. And I have a VA appointment, and I do a lot of research on the VA side. And because I study adults with stroke or Parkinson's disease, I tend to meet and interact with a lot of Vietnam veterans. So it was really kind of an intersection of both personal and professional, and just thinking a lot about what life is like after the war and the needs and ways that we can care for and honor our veterans when they return from combat. So it was really quite a book that really had me thinking about it. I couldn't put it down. So I highly recommend it.
Oh, well, these are excellent recommendations. We will add The Voltage Effect and The Women to our reading list for our listeners to find online. And Kim, you brought up an interesting point here that your research allows you to have these conversations and interactions with unique groups of people that you might not otherwise get to talk to. So what is it like for you having this dual appointment there at Penn as well as at the VA?
I'm so fortunate to have this dual appointment, and I really appreciate the opportunity to be a researcher on the VA side. I think that the VA is such an incredible health system. It's the largest integrated health system in the United States, and they truly put veterans and their needs first. And I've learned so much about different programs and different services that are offered, but then to also have access to Penn and all of the resources, and being faculty here, applying for NIH grants, and just the wealth of training and early career resources that are available here is just, I feel quite spoiled most days between the VA and Penn. And some weeks it's a lot to balance the workload between the two, but I feel very fortunate to have this dual appointment and to experience research on both the VA side and on sort of the non-VA side.
Oh, very interesting. And not only do you get to meet amazing people and work at these great environments as a scientist, I think one of the other things that's really wonderful about careers in science are the opportunities to travel, whether it's for conferences or to present and share your research different places. So, Kim, when you think back about all the places that you've been for science, do you have a favorite?
Maybe in contrast to the more senior folks who have been on this podcast, I'm year 2 of my faculty and we went through a major pandemic. So I feel like my international conference travel has really taken a hit. I will say that as much as I would love to have some really cool place in Europe, what comes to mind is actually San Diego. I've been to multiple conferences over the years in San Diego, different OT conferences, neurorehabilitation conferences, neuroscience. And I've always found that when in San Diego that, I don't know, I have felt the most challenged intellectually. I had a chance to meet a lot of really cool scientists and investigators there. And then there's also right along the waterfront, a wonderful running path that often will go for a run with a close friend of mine and just kind of talk about life or science or whatever we want while we're running along the ocean. And it just kind of has a lot of really fun memories for traveling there.
Definitely. I love the city of San Diego myself and have been there a couple of times for science. So do you have any particular favorite things? You mentioned running on the beach, which I think is amazing. But are there other things that you like to do or see in San Diego?
There is a hike, I think is probably one of the more popular hikes. Maybe it's called Torrey Pines, I think, that is kind of north of the city. And it's just right along the water's edge. You kind of go up in the hills and you're constantly just in these beautiful views of the ocean. And so if I'm in San Diego and have some time to spare, I like to go and do some hiking in Torrey Pines.
Phenomenal. Well, listeners, put this on your travel list if you're heading over to San Diego anytime soon. And we talked about the places that you've been for science. And I think the people as well are an important part of the career in science. And I think, unfortunately, there are still stereotypes out there about what scientists are like and maybe what life as a scientist is like. And we try to break some of those stereotypes on our show by just sharing these more human moments as scientists, whether it's funny memories, quirky traditions, or just other things that go contrary to people's expectations. So, Kim, do you have one of these stories that shows the human side of science that people don't often get to see?
When I was in my PhD lab, I'm a huge college basketball fan because I went to OT school at the University of North Carolina in Chapel Hill. So I'm a big Tar Heel basketball fan. And I was like the only person in the lab who paid any attention to sports. And then March Madness came around. And so I decided to convince everybody to fill out a bracket. And the reason why it was funny was just because no one had the slightest idea who was good. And it brought out the most hysterical lines of reasoning. One of our research coordinators decided to look up all of the team colors and selected her bracket based off of team colors that she liked the best. Another person did states they were most likely to visit or wanted to visit and selected their brackets. Catherine did teams that were good in the 80s. And it just brought out the most clever reasoning in people in the lab. And we ended up doing this over multiple years. And then when I left WashU and moved to Penn for my postdoc, we did it here. And we just did it this past year in the Nudge Unit. And it always seems to be that only a few of us pay attention to college sports, but that everyone can get excited and have fun with sort of thinking about college basketball at the time March Madness. So that's one of my favorite traditions or kind of fun things that seems to happen every year in the lab.
Oh, well, I absolutely love that. And I have to ask him, have you had much success with your bracket selection?
No, this is it's always somebody who has no idea who ends up winning the bracket challenge, which is also makes it really funny. And those of us who do know about college sports end up losing, but it's still really fun.
Oh, I think that's amazing. And I think it's wonderful that you've kept this tradition going over the years and continue to do it in your lab today. And we've talked about some of the amazing questions that you're answering with your research today. But I think oftentimes things hold you back. We mentioned you just got all this wonderful funding, which is great. But oftentimes, whether it's feasibility, time, staff, whatever the case may be, you're not able to do everything you'd like to do at the end of the day. So, Kim, if we took away all of the barriers, you can have anything and do anything. What is the question that you would want to answer most?
Aligned with the questions that I'm asking now on a much smaller scale, if I had all of the resources in the world and feasibility was not an issue, I would really love to stand up a program for people with stroke or with neurologic disabilities who, as they finished rehab or just want to improve their physical activity, that no matter where you live, to be a remote program that anybody could sign up for, where we would have interventions to help you increase your physical activity. And you could sign up into this program. You could be in it for months to years and then be able to see, does this actually change how people use the healthcare system? Does it improve their quality of life? Does it slow disease progression in the context maybe of Parkinson's disease? And just making it available to anyone, regardless of where they live. And I'm particularly motivated by this because I also just think that once you finish rehab, which your number of visits that you get seem to be shrinking more and more each year, you're kind of left on your own to navigate this complex world, often with some degree of disability. And your life has just really been changed by having a stroke, for example. So I feel strongly and am really motivated to think about how we could develop programs that people could then opt into or participate in to continue to improve their health and get better and not have to navigate that one piece of recovery on their own. So I would really love to try and stand something like that up and then see if it makes a difference in quality of life and healthcare utilization and some of those metrics.
Oh, I absolutely love this proposed project. And I think this access question is huge in healthcare. And I know you're within sort of an urban center yourself, but you have this interest in rural health and underserved communities as well. So can you comment on what the challenges are for these people? What are the biggest barriers that would prevent you kind of addressing some of these access problems?
I think it varies by person. I think that one person's barriers are actually different from the next, but probably some common themes. When you think in rural areas, you think about access to technologies or reliable access to internet, reliable access to high quality care, and being able to see specialists or people who really specialize in your disease or in your condition and have that relationship with providers in that space, I think is a huge barrier. And the same is true in rehabilitation. If you live in a rural area, you just probably don't have access to neuroclinical specialists on the PT side or OTs that have expertise in certain conditions and geriatrics, for example. And so I think that that's a huge barrier, is just the supply is low of specialized care. But even in urban settings too, I think that your built environment can be a big problem. If you don't feel safe getting out of your home because the sidewalks are uneven, or you have stairs and the stairs are kind of scary to complete, so you might want to stay home and not go out, or really limit those trips outside of the house, or even in areas where your neighborhood might not be as safe in terms of crime. So you're cognizant of when you leave your home and who might be with you. I think those are just some barriers in access that we don't talk about those enough. And that's why I really like developing sort of remote programs that people don't have to leave their house. They don't have to come to a clinic if you live super far away and drive in. We can come to you and we can meet you where you are to try and help knock down some of these access issues.
Definitely. And Kim, I appreciate you painting this picture of just some of the complexities that people are encountering on an everyday basis. And I like the point that you make that one person's barriers could be quite different from another person's barriers, even within the same environment or across different environments. And we've covered a lot of ground in our conversation today, Kim, and I'd love to wrap up our conversation with sharing advice with our listeners out there. So when you think about your own career and maybe your own life more broadly, is there one piece of advice that somebody gave you that really stuck with you and helped you along the way?
I can think of two pieces of advice, if I can be greedy and share those. The first one was one thing that Catherine said to me when I was a PhD student. I think Alex Dromerick actually told her, but don't love your hypothesis so much that you don't listen to your data, which I thought was very insightful, because sometimes your trial is null, your hypotheses aren't supported. And if you love your ideas so much that you fail to listen to what the data are telling you, that can be a pretty slippery slope. So I found that to be really good advice. And the second one is actually, it wasn't said directly to me, but Richard Thaler is a Nobel laureate in behavioral economics. He's one of the pioneers in the field of behavioral economics. And he was giving a talk one time, and he made this comment, I'll paraphrase it, and I apologize if I completely botch it, about don't be the 100th person to study something, be the first to study something that's unknown and important. And I think about that a lot. I found that to be something that really resonated with me.
Well, I love these two pieces of advice. Thank you so much for sharing them with me and our listeners today. And is there any other last piece of advice, or maybe a last note of inspiration, Kim, that you would like to end our conversation on today?
As junior faculty, This can be a tough world. Research in academia can be difficult. It's full of rejection and lots of criticism. And I think a piece of advice that I would share would be study something that excites you and something that really motivates you and you're interested in, because I think that will sustain you on days that are really hard or when the grants aren't discussed or super critical feedback comes your way. If you're studying something that really excites you and you're passionate about, I do think that really can sustain you and kind of hold you up on the really tough days.
Well, I think that is a wonderful message for our listeners out there who might be navigating the trials and tribulations of their own scientific journeys here. And if our listeners want to learn more about you, Kim, and the work that you're doing, what is the best way for them to do so?
You can always drop me an email. If you go online and you Google my name, you should take you right to my School of Medicine page. I think my profile in the Leonard Davis Institute as well, and my email is listed there. Would absolutely love to hear from anyone who's interested in this work and the work that we're doing. And probably the best way to contact me is, just dropping me an email.
Fantastic. Well, listeners, definitely reach out, get connected with Kim if you have questions and you want to learn more about the amazing work that she's doing. And Kim, thank you so much for joining us on the show today. It's been wonderful to learn more about you and your work.
Thank you so much, Marie. I had a really nice time chatting with you. Thanks for having me on.
It's been great to chat, and listeners, always wonderful to have you here with us as well. We hope you'll join us for our next episode of People Behind the Science.